Gallbladder is one of the most frequent occurring condition which we see in our routine surgical practice. If the patient is having gallstones, it doesn't mean that he needs surgery for everything. So all the gallstones don't need surgery until the patient is having symptoms. So what we say is patient has some complaints which are related to the gallbladder stone. If the patient doesn't have anything related to the gallbladder stone, then there is no need for surgery as such. So first what we'll do is we'll see his complaints with the ultrasound report what is having. So we will try to check his symptoms and we'll examine him thoroughly and see whether this is anything related, this complaint is related about the gallbladder stone. If the problems is not associated with the gallbladder stone and it is just an incidental finding, just we'll keep him in follow-up, and then when he has developed symptoms, we'll advise him to come and for further checkups. So this is one sort of a way of presenting. Another sort of patient presenting is they come to emergency or sometimes they may come to the OPD with complaints of pain which is not very severe but some sort of a colicky pain which occurs after taking fatty food. Initially the patient complains that he had a fatty meal. Post the fatty meal he started developing pain. So it is a mild pain, sometimes it is very severe or it becomes very severe. So he may come to emergency with that. So with mild pain and all, patient sometimes he takes medication on his own, or sometimes he may come to emergency where he has been treated. So here the pain may subside without anything, with medication it may get over and that episode will get over. So but this is a symptomatic condition. For these patients who are symptomatic and who have like pain but they don't have continuous pain, like it has been treated with one episode of medication and all, it has gone better. So in such conditions we tell these patients that you are symptomatic. Once we do further checkup, we do investigations and we found there is gallbladder stones, and then we tell this patient that he is symptomatic and probably he may need surgery for that. So this we can put this patient under elective surgery category and do elective gallbladder surgery. So other set of patients will come with who are having severe sort of symptoms, what we tell as acute cholecystitis. In acute cholecystitis, patient will be having severe pain, abdominal pain, which is associated with nausea, vomiting and fever. So this sort of a patient, he may come to most likely to emergency situation, emergency admission. So once we find that the symptoms are associated with acute cholecystitis, then we do a proper ultrasound and blood test, everything, and depending on the situation, what we could either end up doing the patient like medical management or surgical management. So medical management would be like we give antibiotics, IV fluids and keep him NPO and see if the patient is getting better. So we can do in such acute cholecystitis either an immediate surgery, which can be like if the symptoms are within 72 hours, we can go for a immediate surgery, or we can do it as a later stage. So it depends upon the facility and expertise. So in our setup here, we are doing both the things, like it acute setup. If it is within 72 hours, we are going for acute laparoscopic cholecystectomy, or if it is late, if the patient wants to get it later stage also, we can do in that way. If patient his condition improves, then we can go for that. So another is sort of patients who come with chronic cholecystitis, like they have recurrent pain, they have not got operated, like they come on with symptoms and all, and these symptoms will be recurring. So these patients, they need surgery. So this because they are symptomatic and chronic condition, this acute gallstones are since long time. So these patients, definitely there is indication for surgery, and these patients is better treated with laparoscopic cholecystectomy, the surgery. So some other patients are there where this patient, because of the gallstones may enter into the common bile duct. So the bile is there which is stored in the gallbladder. So while you eat fatty food and all, the bile is pushed off from the gallbladder into the intestine. During this one, some of the stones may slip and come into the common bile duct. When these stones they come into the common bile duct, what happens is it may block the passage of the bile into the intestines. And along with that, there is a common entry of the bile duct bile passage and the pancreatic duct. So sometimes what happens is the stone may come and get obstructed there, and it may lead to acute pancreatitis also. It may lead pancreatitis, that is more severe sort of a symptoms. So in these conditions probably we may have to admit the patient and treat for his pancreatitis also, and see whether the stone is passed out or the stone is still in the common bile duct, and depending on that we may have to do a ultrasound for him, and then a MRCP would be done preferably to see the stone is there in the common bile duct. And if there is a stone in the common bile duct, then he would like to do further treatment. Probably he may need a ERCP, so that ERCP has to be done, the stone has to be retrieved, and later on we can go for a gallbladder surgery. So these are some of the presentations and the way we manage for the gallbladder stone. Apart from this, the most common thing is, it is more common in females. The presentation of gallbladder stones, it is more common in females. So you have a female who is obese, who is during her fertile age. So, and some of the times it is familial conditions are there where the gallstones are very common. So they are more in case of familial history is there for the gallstones, and dietary habits also. People who are having fatty meals and a lot of increased high rich in fats. So these are some of the things which lead to gallstone formation. If you have any doubts or anything related to gallstones, you can come to our hospital.